Namaste and welcome to the next episode of Clinical Ayurved. Myself Dr. Mayuresh Agte. Before starting today's lecture, just I want to tell you one thing. The last lecture I mentioned the lecture number 97, but actually it was lecture number 96. So today's lecture I will number it as 97B. So in future the sequence will be maintained. So we were discussing about Annavasudas Vyadhi and we have discussed about the Hetu of Malavro. As I said, it seems very simple. Malavro gives some laxative and patient will be benefited, but it will be a symptomatic relief unless and until you eradicate the root cause of the Malavro, patient will not get cured completely. So we have discussed in that regard some of the very common hetus which are seen in the practice. In addition to these hetus, we will discuss some more points regarding the hetu of Malavro which are also equally important in today's lifestyle. The first one, which is very commonly seen in almost all age groups, that lack of toilet training. What it means? It means people don't have a regular habit for the toilet. They people go at any time, sometimes in morning, some evening, sometimes even in 2 days or 3 days also. They don't know the importance of daily motion, and hence they do not have habit of going to toilet on a regular basis on the fixed timing. So you have to inquire about this, which is also a major cause of constipation or malavro. And what is the ideal timing by Ayurveda? Early in morning where there is vatakal, and when early in morning there is a good uh, process of the defecation, the whole day it becomes uh, very easy or comfortable for the everyone. So there is a verb in the English, a good movement of bowel is a good morning. So let us emphasize our patients to have create the habit of going to toilet early in morning every day. First few days it will not happen, but as the body gets habitual, the system will work accordingly. Many a times there is a laziness behind that. Many a times, especially in the children, there is a school early in morning, they wake up late, and so they avoid to go to toilet to save the time, and then whole the system gets disturbed. So hetu of Malavro, which is commonly seen, is lack of a good toilet training. Second hetu, which is also very a major important hetu, is Vega Vidharan. Because of the work, patient tries to go afterwards, let us finish the work today first, and then we'll think of the going to toilet, and this habit increases day by day. So this Vega Vidharan ultimately lands the patient into the chronic constipation symptom. For this Vega Vidharan, there is a very important factor which majorly contributes, is lack of good facility of washrooms, especially in the offices, in the public places. So in spite of having a wish to go to the toilet, people avoid to go toilet because of the lack of the good facility, cleanliness, water supply, etc. Especially women are more suffered because of this lack of good facility in our country. So Vega Vidharan is another major hetu. You have to ask the patient if there is sensation of toilet, did you postpone them because of some work or some any other reason. First thing, if there is no good facility, then you have no choice in your hand, but at least ask the patient to convey the authority to have a good clean toilets, so that everyone can be happy with that facility. So this is another major hetu which is seen in the practice, and it contributes very majorly in this symptom. The other hetu, if patient is on some medications for a long time, and if that medication has some side effects as a constipation, so in the history you have to go, if the patient is suffering from chronic constipation and coming to you frequently for the same symptom or same problem, then always keep in mind if any medication is going on. The hetu which is also very commonly seen, that some habit which give trigger to the motion process. For example, many people have a habit of having tobacco, and when they chew tobacco, then only they get the reflex. Or some people have tendency that have a good, had 2 or 3 cup of tea, and then after they get the sensation of the toilet. So if this is another hetu, which if they don't get tobacco or they don't get that stimulant in their life, it may cause constipation. Or even sometimes the patient suddenly stops this uh, tobacco or habits as to get out of that habit, and patient gets start the constipation, because the body has got a habit of that trigger, that stimulant, for over the years. So all these things which I have discussed in last lecture and in today's lecture also are important, in which regards to resolve this problem of constipation permanently. Otherwise, if you don't look after the hetu, and if patient doesn't follow the hetu parivarjan in his lifestyle, then this problem will occur recurrently, and patient will complain that I am taking medicine, I am okay, and if I stop the medicine, I again get the same problem. So always keep in mind, to eradicate this problem totally, the hetu parivarjan in your lifestyle is very important. Now, if you come to the treatment part, as I said in last lecture, that yes, it is very easy. Malarod and give some laxative, patient feels better. But is it so? Now I will put a question in front of you. There are many karma explained in the Grantha. Anuloman, Stramsan, Bhedan, Virechan. Okay. Now you have 4 patients in front of you. 4 are complaining of constipation, and you have 4 drugs like Aragvad, like Snuhi, like Erandadale, which have different action like Stramsan, Virechan, Anuloman, Haridake, etc. So you have 4 drugs. One is doing Anuloman, one other is Stramsan, then Bhedan and Virechan. And there are 4 patients in front of you having same complaint of constipation, that do not have any other complaint. How will you choose to whom Anuloman is indicated, to whom Stramsan is indicated, and other karma like Bhedan, Virechan? How you will decide which drug, which karma is suitable to the which patient which is sitting in front of you? So this is homework for you. We will discuss this point in the next lecture. Thank you very much.